normally in the community is for our palliative patients that regularly need medication for pain, for agitation. Everyone, welcome back to my channel. It's been a while, guys. Today I feel like taking you guys to work with me. I've done this before, but I want to do it again because I realized that with the first video that I made, I had a lot of questions and so many people were kind of interested in what district nursing is about. As you all know, I'm a district nurse or community nurse based in the UK, and I basically work in the community. I visit patients from house to house. Sometimes we visit some care homes. I'm not a ward person, as I've already said. I love being in the community, and today I want to take you along to work with me once again. If you're interested, let's hop along. But before then, let's go into my list. We all have computers, laptops. I'm going to show you. Let's go. So as I said earlier on, we all have got laptops. This is mine. I'm just about to log on. I haven't logged on yet. If it is logged on, I cannot show this because we'll have the list of my patients. Confidentiality. I am not going to show the residents of my patients. I am not going to show the names or mention names because of confidentiality once again. So basically, I'm going to show you what I do day to day as I am out there visiting patients, but nothing about the patient. So this is our laptops. We've also have got phones. Everybody has got one. We all have got one. This is for if they need to call you for anything from the office. In the morning, as I am about to start, I need to sign in. So I'll send a text message. You can send a text message or call the office for them to know that you are actually on duty. Because now we are kind of working from home, or it's the weekend. This is Saturday and I'm working this Saturday. We kind of rotate. We don't work every Saturday. We work, I think, every 4 weeks. I am doing part-time, not full-time. I'm doing 3 days a week because I've got a little child and because of childcare. So because I am doing 3 days a week, I do weekends every 8 weeks. But those that do full-time, it's actually every 4 weeks, I think. Every 4 weeks they have to do the weekend. So it's not every weekend that you have to work. We kind of rotate. So you have weekends that you work and then you can go for a whole 4 weeks without you working, or depending on the number of days that you do. That is what happens in my team or where I'm working. So I am on duty this weekend, Saturday, Sunday. When we are working on Saturdays or working on the weekend, we normally work from home because there's nobody in the office. But on the normal working days, before COVID and everything, we used to go in the office in the morning where we all print our list and then we go out and see our patients. But now I think most of us, or mostly, we are working from home. That means you start from home straight to the patient house instead of going to the office to get your list. So you can either print your list if you've got a printer, but I normally write. So far as you are able to capture everything. So I've just got a piece of paper here and my pen that I'm going to write my list. First of all, log on. Okay, we have a smart card that goes into the laptop. It allows you access into what we call system 1. That's the system that we use to do our documentation, check your list and everything. So you go through your list, you write it or either print it, or you can go to the office and print it, because I know some people still go to the office in the morning, but you are not really obliged because of this COVID thing. They don't want us all coming to the office all together because we are not supposed to be there. So many people, I think not more than 6 people there at a time because of COVID, you understand? So I'll write my lists and then I'll sign into the office to let them know that I've started work, and then I'll go out and see my patients. So I'll log in and then I'll go through what I've got today, which is a Saturday, so you know exactly what I'll be doing today. Normally on Saturdays, it's basically we try as much as possible not to put dressings and other major things that can wait till probably the weekdays, because on Saturday you are the only person on duty. You have nobody else. So if you've got lots of stuff, you struggle. So normally we do the very essential ones that cannot wait till Monday, Tuesday, or whatever the weekdays, like the insulins, medication, those stuff that needs to be done. We have to do them daily. So I'll log on and I'll let you know how my list is going to be for today, and then we go out together to see my patient. Before then, let me grab my cup of coffee. In the morning, it's normally coffee. I'm not really a morning person, so I'm just going to grab a cup of coffee and then we go. Yeah. So I have logged on now. I've got my coffee and I'm just going to go through my list I've logged on, and I'll let you know what I've got today. I've got loads of insulins, loads of insulins, because when we are all on duty during the weekday, we kind of share the insulins amongst ourselves. But when you are on your own on the weekend, you mostly do almost all the insulins. You can have other teams help you. That is, if your team has got lots of insulins, but normally you do most of the insulins. So I've got insulins, lots of them. I've got a syringe driver later on in the afternoon. We will talk on our way as we go along. I don't want to sit down and it will make it very boring. So we'll talk and go through what I'm doing at the moment or today. So I've got an insulin, I've got a dalteparin injection, and a few stuff. They can even call me if we've got palliative patient on the list that needs to have some subcut injections to make them feel comfortable. These are nursing terms, so if you're not a nurse, you might not understand. Subcut is just an injection that goes into the fatty area of your body. We have specific areas you can give subcut injection. It just means subcutaneous, so injection that goes into the fatty areas of your body. Some injections go into your muscle. We call them IM. That's my list. I've written it down now. Let's go see patients. We're wasting time, aren't we? So guys, this is the state of my car. As district nurses, we have everything in the car, from syringe driver. You need to have everything, a piece of everything, so when you go out you are not short of anything. So if you've got a really small car, then you might struggle with your shopping, personal shopping, because your car actually takes everything. So I've got my jacket here. I'm not wearing it because it's summer. I wear it during winter. We've got two, a very thick one, that's the very thick one, and we've got another lighter one. Basically now I'm not wearing it because it's quite hot and we don't need jacket. I've got my sharps pen there. We carry a small one like that because there are some places when you go they don't have sharps and you need to have your own. I've got my blood. It's very disorganized, guys. It's very, very disorganized. I've seen some of my colleagues who have got really their stuff really organized, but the most important thing is I've got everything that I need here. So let's get to work. Pull this one back here and then off we go. Before we go, I just wanted to clarify something. When I made my first video about district nursing, I had a few questions about district nursing and how you can even apply to become a district nurse. People were inquiring whether they need any special training. No, you don't. And as a newly qualified, because I came into district nursing immediately as a newly qualified nurse, so you don't necessarily need to have any experience on the ward or any experience whatsoever before you can come into district nursing. You can come straight from uni into district nursing, and when you come they train you just like when you go on the ward or wherever you go, they will train you. So you need to be trained in everything, and then you need to sign off that you are competent to be able to perform those skills before you can even go ahead. And there is no specific time for you to be signed off. They wouldn't say maybe 2 weeks, 3 weeks or whatever. It's when you are comfortable. I would say that when you are a nurse, it doesn't matter where you are. If you are not, even when you've been signed off and you are not confident in doing it, then you do not do it, because when you do it and something happens, you are liable for whatever happens, and then it can even cost you your pain. So yes, you can come to the community straight from uni, but you'll be trained in everything that you need to know. So you still have to be signed up for medication competency and everything, syringe driver, catheter, whatever skill that you need, you'll be trained. And unless or until you're very competent or you're very confident in yourself that you can do it, that is when you'll be allowed to do it. Yes, I hope that explains it. If anything comes into mind as we are going, we'll have a chat about it and we can discuss it. Yeah, so let's go see our first patient, which is basically going to be an insulin. So this is what we use. I think the other time I did not really show, but if you're a nurse, I think you will know what it looks like. We all have got one. Everybody has got one. So that is how it looks like, this is where we used to check the blood sugar level of a patient before we give the insulin. So we've got our strips, everything is in here. Okay, it's a small bag or a small pouch, did I say well, and it's there. You carry it with you wherever you go see, or whenever you go see an insulin a patient with diabetes. It comes with the testing kits. We test it every Monday. Every Monday morning we test it to be sure that it is working fine before we go out and see the patient. So that's what I'm going to do. I'm going to do an insulin first for one of our diabetic patients, which I prioritize. Some of the patients of the insulin, it's once a day, some of them it's twice a day, some can even be 3 times a day. So you prioritize. Even though they are all insulin, you need to know which one you have to see first. If it is somebody that is twice a day, you want to see them first, because you have to go back. You need to give, there is supposed to be an interval between the first dose and the evening dose, or the morning dose and the evening dose. But if it is once a day, I think all our patients, actually the morning insulin need to be seen by 11. By 11 you should have seen all the insulin patients. So I'm going to see the first one with this. Let's go. So I'm all done with the insulin, going to see the next one. So I just got to my next destination, which is a syringe driver. I think I showed I did explain what a syringe driver is in my previous video, but it's just a machine. It's like a computer, a small computer where we load medication into a syringe. That's a syringe and that's a driver, and we put it in, and it runs for 24 hours. Normally you can let it run for whatever hours you set it to, but normally we set it for 24 hours. So the next time we should see this patient is tomorrow, 24 hours, yes, unless something happens. Sometimes it can block, sometimes there can be issues with it, and they will ring us to come and check it. But if everything goes on well, 24 hours it should run for, and the next time I should see this person, or we should see this person, is tomorrow, just around this time. So who do we give a syringe driver to? Syringe driver is normally given, normally in the community, is for our palliative patients that regularly need medication for pain, for agitation, vomiting and those kind of stuff. We cannot be here giving them Subcat every time, so we put this medication for it to run into the system or through the system for 24 hours. So their pain or whatever discomfort they are going through is managed. So if a patient is calling out, a palliative patient is requiring medication, Subcat, as I said, Subcat is an injection that goes into the subcutaneous. Subcat is subcutaneous fat. Then we will consider, or we consider giving them a syringe driver, because if they are calling out every 2 hours or every 4 hours for us to go give them injection to relieve them of any symptoms they've got, then it's better we give them syringe driver. So I'm going to do this now, and I come back and then we go see the next one. Let's go. So just got to the next patient, which is a chemo disconnect. It's chemotherapy disconnection. So people that are undergoing chemotherapy treatment, cancer patients, the chemotherapy, which is chemical that is attached, that goes into the system, is very toxic. So when it finishes, we come home and disconnect it, wrap it up nicely, normally in a double bag, so you don't want any leakage, because I said it's very toxic. You don't want it around. So we wrap it, and the patient will take it back to the hospital. Then we flush the line, and if we need to dress it, we dress it. We normally dress PICC lines once a week. We flush it once a week, and we dress it once a week. We normally do on the same day. But the disconnection of the chemotherapy might not necessarily be the same day. So what I'm going to do now is just to disconnect the chemotherapy from the PICC line and flush it with Hepsal and saline. We normally flush it with saline first, and then heparin, which is Hepsal. It is not every trust that does that. I've seen trusts that only use saline to flush. We flush with both saline and Hepsal. Hepsal is just to prevent any black clots in the line. So if there is any black clot in there, it kind of dissolves it, so the line stays patent, it doesn't block. So that is what I'm here to do, and when I come back, we go see the next one. It's a busy day, busy day. Let's go. So we are still wearing PPE. We need to wear everything. Nothing has really changed, even though the lockdown has been lifted and people can wear their masks or not, but healthcare workers still have to wear everything. So currently we are not really wearing the visor, because the visor, you need to get rid of it. This one, it's reusable. When you see a patient, you just wipe it clean and then you wear it for the next patient. So I'm done with this patient. Let's go see the next one. I'll tell you what it is when we get there. And yeah, I just remembered one other question that I got was the fact that to become a district nurse, must you drive? I will say with this one, it depends on you and where you are based. Where I am based right now, the busing system and public transport system is not that easy. So if you're not driving, you will really struggle as a district nurse, because your patients are not like close by. It's not like they are next door to each other or neighbors. You drive all around. You can drive for a few miles or miles. You can drive for a few distance before you get to the next patient. Sometimes about 8 minutes, 10 minutes, 11 minutes driving. So imagine if you don't have a car and you have to walk, or you have to take public transport, which is not very reliable where I am currently, then it will be a struggle to become a district nurse. If you're in London, yes, you can. Probably you have to hop on from one bus onto the other. As I said, the patient don't live close by, so you will struggle as well from one bus to the other. I don't think it will be that easy. It will be very hectic. And the fact that you need to carry stuff with you, you saw the boot of my car. I've got so many things there, and if you have to carry that with you, because sometimes you see some patients that don't have things in their house, you need to carry your own. So if you do not have all these things with you, or you have to carry a big bag or probably wheel a bag behind you, you understand what I'm talking about. So I would advise that before you go into it, probably learn how to drive, get a car, because it's even one of the requirements, something that they look out for if you've got a car before they even consider giving you the job. So think about it before you try to apply as a district nurse. So guys, we are at the next patient's place. I sit in the car to do this video because I don't want to get out for anybody to see the environment that I am at, or see any address or house number or anything. So that's why I keep talking in my car but not outside. I hope you guys understand. This one is an IV antibiotics, so it's another PIC line that I'm going to give some IV antibiotics. So yes, as I said earlier on, I think the PIC line, did I explain PIC line already now? It goes, I'll insert a picture. Okay, it goes into the arm or wherever, but normally in the arm. And this one is just an antibiotic that is just going to run. We normally run it for between 15 to 30 minutes. They have a stand. If they don't have a stand, we use clothes hanger. We use a hanger and hang it probably normally by the window, so they sit down and wait for the whole thing to go. You see, in the community we do a lot. We do everything. When you are a district nurse, you are supposed to know almost everything. On the ward, it can be, you can be on a specialist ward where probably you're dealing with hearts. You can be gynae or whatever specialist that you might be on. But in the community, we do everything. In the community, we do everything. So we need to know how to do a PEC feed, PIC line, catheter. I had no catheter today. Everything basically, because anything can come into the community and we have to do it. So yes, I'm going to do this one and then we continue. I think after this one I'll have my break. I'm going to go home. I'll be done for the AM one, and the next one is going to be an afternoon visit. So from here I will go home and grab some lunch and then we continue. Yeah, and I've come home for some break. Usually during the Monday to Friday we go to the office for our break, and then we have our handover as well. Weekend we don't normally do that. You basically work from home. I'm trying to get something to eat and then I'll do my notes alongside for the patient that I've already seen, and from there I go back for the rest of my patients. It's actually 1 o'clock, I think 1:15. Our break is normally between 1 and 2. That is for the team that I work. It's not for all district nursing teams. For where I am now, that's our break. We take our break between 1 and 2. I'm just gonna grab a bite because I haven't really had anything to eat this morning. I just had a cup of coffee. I'm just gonna have some noodles. Whilst I do my note alongside. So basically that's what I'm doing. Just documentation, and then I'm out there again to see the rest of my patients. and we'll continue working as usual. I'll be taking you along the rest of my visit, or the rest of my patient that I need to see. So hang around, let's enjoy working in the community district nursing. So guys, I have gone to see the rest of my patient for the day. I just got home. It's basically around, I think, 10 minutes to 5. I finish at 5, so right on time. I still have got a few notes to do. That is the patient. I saw 2 patients this afternoon that I'm going to do my notes, and then I'm done for the day. I still have got to text to log out or to sign out and let them know that I'm done for the day. Basically, that's what we do. That's what we normally do on a day-to-day basis as a district nurse. If you've got any other question, anything that probably I did not mention, I forgot, you can ask in the comment section and I'll reply you or I'll answer you. But I am done for today. Thank you for watching, guys. It's been amazing having you on road with me. District nursing is mostly driving. If you don't want to drive, it's just mostly moving around from house to house, and that's basically what we do. And I love what I do, and I love district nursing. And thank you, guys. I hope you like, share, comment, and I'll see you in the next video, guys. Bye everyone. Bye.